I am Jennifer. I work at the Pender Medical Clinic currently. I have been a nurse since 2008. I have always worked in rural healthcare, but when I came to the Pender community, I started out as a hospital floor nurse, then transitioned to a clinic floor nurse, and now my current lead role is in the health coach office in the Pender Medical Clinic. That role has been very exciting and challenging. I love what I do. I've loved rural healthcare. I have grown with the patients too. I've seen them in the hospital, and then when they've gone home, I feel like it's a benefit to the patient as well, just seeing them transition to each part of their healthcare.
My name is Chelsea. I am originally from Pender and I work at the Pender Medical Clinic. I started out here in 2011 as a CNA, and I did CNA through nursing school, graduated with my associate's degree, came back and started as a med surg at the Pender Community Hospital. And from there, while I was working, I obtained my bachelor's of nursing online. So then I kind of did that. I transitioned into also ER care and then onto OB care, and worked on the floor for 9 years and did med-surg, ER, OB. I loved the variety that I got there. Recently, I transitioned in the last year to as a triage nurse at the Pender Medical Clinic, which is a great role. I love still that I got a variety of everything. And now in the last month, I have become the clinical nurse manager at Pender Medical Clinic. So kind of have all had my whole medical experience here. Started out as a CNA and now I'm in a leadership role. So that's been great. The thing I love about rural healthcare is caring for my community members. You know, you build such a great bond with your patients here in rural healthcare because they are your community members and you want to give them the absolute best care ever that they can receive, and just keep your community healthy and do what's best for our population because you have such a big bond with your patients. So it's great to see them from delivering their baby to also caring for their grandma to the baby. So it's just awesome to see that we just work together and care for our community as a whole. I see there's a lot of advantages. We have a great outpatient department here that brings a lot of great specialty care to our patients also. So they're able to get that care that they need close to home yet, with incorporating the specialty doctors here and our family practice doctors. They truly care about our patients because in a rural community is different than a larger community because we have a great bond with each other. We see each other at the grocery store, and it's special. It truly is special.
I would also agree with that. My big win, I guess, in a rural health clinic from the standpoint that I've seen it is just being able to take care of patients. They are very thankful for the care they get. They just love you helping them out. It is as simple as of helping them fill a medication, or it could be as helping a patient get to like a nursing home, those type of things. I just in general just love taking care of patients.
They're very grateful.
They are very grateful. Yeah.
I would say go for it because you feel like your cup is full because of the work you do. I guess it's very meaningful work, and you feel like you have a purpose for your community and for you're doing great as a human. I get a lot of fulfillment out of my job.
Yeah, be open for the challenge. Rural community, you get a little piece of everything. So be ready for the challenge and accept it, and you will find fulfillment in your life.
It's challenging, like Jen said, but I guess you're always learning something new, and that's what's great too, is because you don't get bored. You learn something new all the time. You get to experience new experiences all the time, and it's a great career if you want to challenge yourself and have a lot of fulfillment. Nursing is a great career. Every day looks different and you won't ever get bored.
You just don't know what your challenge is going to be for the day. Some days, You could start out as a regular perfect schedule, and then you have to figure out XYZ, for a patient. So no, it's never the same. And two, like in the clinic, it's never the same, I don't think, for us. Always a challenge.